Great. Thank you for joining us to discuss today's major announcement from the Department of Health and Human Services. I'm Jennifer Klein. I'm the Director of the White House Gender Policy Council. As you will hear from Secretary Becerra and Director of the Office of Civil Rights, Melanie Fontes-Rayner, the Department of Health and Human Services is issuing a new final rule to strengthen privacy protections for lawful reproductive health care under the Health Insurance Portability and Accountability Act. Before I turn this discussion over to them to provide more details, I want to put this important announcement in context. Protecting reproductive freedom has been a priority since day one of the Biden-Harris administration, and these efforts became even more important after the Supreme Court overturned Roe v. Wade nearly 2 years ago. The aftermath of Dobbs has been devastating. Today, 21 states have abortion bans in effect, and other extreme bans are set to go into effect in states like Arizona and Florida. More than 1 in 3 women of reproductive age live in states with bans, and Republican elected officials continue to propose legislation to ban abortion nationwide. Women's health and lives are at risk, and women are being forced to travel hundreds of miles for health care that would have been available in their state if Roe were still the law of the land. Doctors and nurses are being threatened with jail time for providing the care they were trained to provide. And the chaos and confusion from overturning Roe has disrupted access to fertility treatments for families who are desperately trying to get pregnant. The President and Vice President believe this should never happen in America. It's why the Biden-Harris administration is fighting to restore the protections of Roe in federal law, and why the President has directed his administration to protect access to a wide range of reproductive health care, including abortion, contraception, and IVF. Secretary Becerra, Director Fontes-Rayner, and leaders across the Department of Health and Human Services have been key partners in this work, from helping to ensure that women experiencing devastating pregnancy complications receive the emergency medical care they are entitled to under federal law, to expanding access to affordable, high-quality contraception, to the important work being done to protect health privacy. Today's final rule, which is consistent with the President's executive order, the first one he issued after Dobbs, is an important step forward in our fight to ensure patient privacy and peace of mind, because no one should have their medical records used against them, their doctor, or their loved one, just because they sought or received lawful reproductive health care. With this new rule, the administration is continuing the fight to protect patients and ensure access to high-quality care. And with that, I'm honored to turn this over to a tireless champion and my close partner, Secretary Becerra.
To Director Klein, and in advance to Director Fontes-Rayner and to Dr. Floyd, who is here as well, thank you for the work that has been done on behalf of Americans throughout this country to protect rights. When Dobbs overturned Roe versus Wade, it did more to damage access to health care than I believe anything that we can think of in our lifetimes. And it did more than just overturn access, the right to access abortion care. It took away the right to access care, period. And for those who don't believe that, all you have to now look at is what is happening post-Dobbs. And you're seeing that today, families who are hoping to have children through in vitro fertilization are finding that Dobbs may have ruined that opportunity. They're finding that access to contraception care, which is not abortion, are now being threatened as well. And so today Americans are living lives recognizing that, at least for women, they have fewer rights today than their parents did, their mothers did. And it is difficult sometimes to comprehend. But there is one thing Dobbs did not take away, and that is the right of Americans to their privacy. And we are here today to make that very clear. Each and every American still has a right to their privacy, especially when it comes to their very private, very personal health information. Please make no mistake. When you access care, when you go see a doctor, when you enter a hospital, when you see a medical professional, and you provide, because you're required or you're requested, very personal health information, that information is entitled to protections under federal law, perhaps even state law. But under federal law, you have rights to your privacy. That's what today is about, is making sure that Americans who convey very personal, private health information to a provider know that they have rights, that that provider knows that he, she, it all have rights to have that information protected. And if someone tries to extract that from you in coercive ways or creative ways, please recognize we can take action. Today's rule is about making sure it's clear that your right to privacy is protected, and that here at the Department of Health and Human Services, through our Office for Civil Rights, and throughout the Biden-Harris administration, we will help protect your right to privacy. The technical aspects of today's rule, as a good attorney, I'll leave it to my counsel to explain. The actual impact on the ground, I suspect Dr. Floyd can give you some real clear answers. But I don't think there's any doubt, and having Director Jen Klein here makes it even more emphatic that President Biden and Vice President Harris were serious. We will protect your rights to access the care that you need, and we will protect your privacy when you access those rights. With that, let me now turn it over to our Director of the Office for Civil Rights, someone who has been tireless in this effort, Director Melanie Fontes-Rayner.
Thank you. And thanks to you and Jen for kicking us off and all of your important leadership that you execute across the government. So I'm Melanie Fontes-Rayner. I'm the director at the Office for Civil Rights at the U.S. Department of Health and Human Services. My office enforces federal rights with respect to civil rights, as well as privacy rights, things like HIPAA, to protect the privacy and security of your health information. Since the Supreme Court overturned Roe v. Wade, we have heard from patients and providers, medical organizations, and many more across the country on their worries about their ability to access health care and its impact on their privacy. As a result, individuals may hesitate to interact with or seek care from providers, health plans, pharmacies, and related health applications out of fear that their data will be tracked and or shared with state agencies, law enforcement, and others. No one should have to live in fear that their conversations with their doctor or that their medical claims data might be used to target or track them for seeking lawful reproductive health care. That's why today, the Office for Civil Rights issued a final rule to bolster patient privacy and trust, the HIPAA privacy rule to support reproductive health care privacy. HIPAA was created to allow for the exchange of medical information, which helps improve care coordination and health outcomes. As part of this, Congress contemplated possible medical privacy issues and required HHS to establish a privacy standard. Today's rule is in furtherance of this objective. This rule prohibits those regulated by HIPAA, healthcare providers, health plans, clearinghouses, and their business associates from using or disclosing a person's protected health information to conduct an investigation into or impose liability on any person for merely seeking, obtaining, providing, or facilitating lawful reproductive health care, including abortion. This means that if a person receives reproductive health care, such as a pregnancy test or treatment for an ectopic pregnancy, and that reproductive health care is lawful in the state where the care is received, the information about the care cannot be disclosed or used by the healthcare provider or health plan for an investigation or to impose liability by law enforcement on the patient or the provider. And if the reproductive health care, like contraception, is protected, required, or authorized by federal law, including the Constitution, that may also not be used or disclosed based on this rule. HHS and my office, the Office for Civil Rights, we're here to help protect reproductive health care information and access to health care of every person across this country. If you believe that your health information privacy rights have been violated, you may file a complaint with my office at hhs.gov/OCR. Thank you. Sorry. And now I'd like to present Dr. Serena Floyd.
Good morning, everyone. As was mentioned, my name is Dr. Serena Floyd. I use she, her pronouns, and I am proud to say that I am a board-certified OBGYN and an abortion provider. I'm here today as a volunteer advocate for abortion access and rights. For over 20 years, I have had the privilege of serving as a reproductive health provider, and for the past 10 years, I have done so serving patients right here in the DMV at Planned Parenthood. We are in the midst of a public health crisis. A crisis created by blatant attacks on reproductive freedoms of those I care for, of our communities, and even my own daughters. Attacks that disrespectfully ignore individuals' personal agency, autonomy, and their very humanity. As an abortion provider caring for the residents of the DMV, as well as those forced to travel here for care from as many as thousands of miles away, I see firsthand the chaos, confusion, fear, and anxiety that these unrelenting attacks cause. Attacks on reproductive freedom that have real consequences for real people and their health. Patient privacy has always been paramount in reproductive health care, but with stakes higher than ever before, there is an urgent need for our leaders to do whatever they can to ensure privacy protections to the fullest extent of the law. We are living in a world where patients, healthcare providers, and support persons are at risk of criminalization for seeking, obtaining, providing, or facilitating care. At this moment in time, breaches in patient privacy can have dire consequences for my patients and for myself. This should never be the case. Your personal health data should never be used against you, not by prosecutors, not by lawmakers, and not by private citizens who have been encouraged to enforce abortion bans. That is why this rule from the Biden administration to increase protections for patient privacy under HIPAA is critical. Everyone deserves access to the care they need, free from fear that their health information will be compromised or used against them, because abortion is health care. Planned Parenthood health centers are committed to protecting patient data and ensuring that everyone has access to the care they need when they need it. I want to say thank you to President Biden, Vice President Harris, Secretary Becerra, and Director Fontes-Rainer, and the entire administration. They are leaders with a fierce commitment and indomitable resilience that those of us doing this work and our patients need and deserve. Thank you. With that, I will turn it back over to Secretary Becerra.
We'll go ahead and take some questions, right, Sam? Yeah. Hey, Sam, I'll let you tell people.
Go ahead. Yes, thank you so much for holding this today. A lot of abortion rights advocates might look at this law and say that it sounds like it doesn't protect women living in states where abortion is largely outlawed. Say ordering a pill online in their state where it's outlawed. Can you say why the rule doesn't go that far?
Let me go first here, and we'll see if we can add anything to what you say.
You want me to go first? Sorry, I thought you said you were going to go first. Yeah, so the rule is actually meant to help when women travel. We know as a result of Dobbs that people have to travel to seek lawful reproductive health care. And so when a woman travels from one state where the care might be banned to another state to receive lawful reproductive health care, no matter what that health care is, whether it's a pill or it's a procedure, it's just a medical examination, that when that woman goes home, her medical records will be protected, herself, her providers, her home providers who literally had nothing to do with the care she received in the first instance, they will be protected and they'll be able to say, no, you cannot have this information. And the provider in the state where she traveled will also be protected from folks reaching in to go after that type of medical care, which is one of the main goals of this rule, so that women can seek care even in the face of the patchwork of laws we have now across the country, how people receive care.
Can I just add real quickly on that? We have no illusion that everything that the president has urged us to do with our authorities is going to undo Dobbs. Dobbs took away rights. Until we have a national law that reinstitutes Roe versus Wade, we're going to have issues. but that doesn't stop us from doing everything we can to protect every American's right to access the care they need and to have the privacy they need. Understanding, again, Dobbs had consequences.
Ian Lopez with Bloomberg Law here. I imagine you're expecting lawsuits over this rule, kind of given past actions by HHS that have immediately been taken to court. Could you comment on how the agency is preparing or just anything on that front?
Yeah, and again, I invite anyone who wishes to comment on this. This is par for the course. We're going to do everything we need to do. And here's my pitch. If you're accessing the care that you think you need or your provider has told you you need, then please remember we want to protect your privacy. If you think someone abused of their privilege to access your information, we want to know if you need help. If you believe your privacy was abridged, someone violated your right to privacy, let us know. Let us figure out if we can protect your privacy, but more importantly, not just yours, someone else who might find themselves in a similar circumstance. We don't believe anyone should have their privacy violated. We want to make that clear. Anyone who violates, we have the ability to enforce against you. I don't know if anyone wants to add.
I think that was perfect.
Hi, Kara Smith with Inside Health Policy. Thanks for taking my question. I've been reporting on the American Privacy Rights Act that was recently introduced. I was wondering how OCR's actions through this new final rule may interact with that privacy bill if passed, or whether the two would complement each other.
Sure. So I'm not able to comment specifically on that piece of legislation. I will say my office typically, when there are privacy legislation, whether it's in the House or the Senate, we do provide technical assistance because we do, Republican, Democrat, we want to make sure folks are following the law and not doing something that would interfere with enforcement capability. And I would just say HIPAA itself, right, is the floor for privacy across the country. And that doesn't change no matter what legislation is passed. It continues to be the operative when it comes to healthcare.
And recognize again, our regulations must conform to statute. A new bill is passed, becomes law, new statute. We have to make sure our regulations conform to new statute.
Sorry. Hi, Emma Bevins with Fierce Healthcare. Can you speak to any changes that are in the final rule as compared to the proposed rule from stakeholder feedback you got on the proposed rule?
Sure. So one of the areas we got a lot of comments on was the exact example I used earlier. So someone travels from state A to state B to receive lawful care, and then they go home to state A. And what's happening is on the ground in state A, law enforcement may be going to state A and saying, we want this information, we want this data. And that state A, those providers, they didn't provide the health care. It's their patient, and they assume it was probably lawful, but they didn't provide the health care. And so the final rule has a presumption of legality in those instances, just those instances, to help take some of the burden off providers and to make it more workable for those providers would be one change. I think generally speaking, the rule is mostly finalized as it was in the proposed rule, and not a lot of huge changes.
Cirusa with Politico. Thanks so much for having this press conference. Just a follow-up to that last question. I know some Democrats had asked that the final rule required that law enforcement have a warrant to request this information, but the proposed rule required a subpoena or a lower threshold. Has that changed in the final rule?
So we did receive incoming from some senators specific to that point. The final rule doesn't get to a requirement for a subpoena or warrant. Those things are under the existing HIPAA privacy rule, and they continue to operate in the same way. However, this is a really important step. We know that we can do more in this space, and we're happy to work with our partners in Congress to think about how else to protect privacy, right? This is a really critical action that will help people feel safer when they go seek care. It'll also help providers. I've spoken to many providers who, you probably heard the same thing, who say, I live in, we'll just pick on California, but I live in California, but when I go home to state X, I'm really worried about what's going to happen to me, right? And so we know that there's a lot of those instances and that we have to do more in this space to think about healthcare.
Dr. Floyd, did you want to add anything to that?
Yeah, I think that is 100% correct. As a healthcare provider and as someone who works with a team in order to take care of the patients that we are taking care of, there's absolute concern about how the desire or the attempts to seek out patient information and details about provision of care, how that can have significant consequences for our patients, most importantly, but also for us as providers. And as someone who does see patients who travel from all across the country at our health center here in D.C., it's a reality. And I have had patients ask that question of, is this information going to get back to anybody in the place where I'm coming from? Are there going to be consequences for me, when I go home? What can be done, to make sure that there are no consequences for me? So this is really, really important that these protections are being put in place.
Oh, thank you. Sally Persons with Fox News. Thank you for holding this press conference. Mr. Secretary, critics of the administration are saying that this is an election year, abortion is becoming a political issue rather than a healthcare issue. What would be your response to that?
We don't have Roe versus Wade. Things have changed. Women are having their health compromised. 10-year-old girls are having to leave their state to access the care that they need. There was nothing red or blue written about that. That's just a fact. The Dobbs decision took away rights. We're going to do everything we can to make sure Americans access the health care they need. And today's step is just another important part of that effort to ensure that you feel comfortable accessing the care that you need. If your privacy can be violated simply by trying to exercise the health care you need or your medical professional tells you need, that puts at risk whether you feel comfortable getting that health care. This is like a chapter in 1984. This is as Orwellian as it gets, that women have to ask providers, or providers have to answer the questions if information that's private is going to be shared with someone else, has nothing to do with the provision of that care. All I can tell you is that 6 people decided to change the life of Americans. We're going to take action, and it's based solely on that. We took action the moment the Dobbs decision became public. We're not stopping. So, healthcare.
Final question, Sarah? Thank you. Are you going to hold her? Okay. Sarah Obermal from Stat News. Going back to the lawsuit question, the Supreme Court's going to hear arguments in EMTALA very soon. This could be seen as complementary to the EMTALA rule. So if they go for narrowing that again, what kind of backstop would you have for both of these policy changes?
The case is right now before the court. We're somewhat limited in what we can say other than what we pretty much said in our briefs. The law speaks very clearly about providing emergency medical care to all Americans who need it. We believe that that is the right law. We're going to vigorously enforce the law because when it's an emergency, you should be entitled to receive the care that you need. And how that plays out in court, we'll find out. All we know is we're going to continue to vigorously defend Americans' right to access their care that they need, and when they do, to know that the information they've provided about their personal life, very private information, remains under federal law private.
Thanks, everyone.
Thank you.